Data from the Public Health Agency of Canada shows colorectal cancer is the third most common in the country. It's also the second leading cause of cancer death. Certain factors increase that risk, including age and diet, specifically processed foods. Michael Brauer is a professor in the School of Population and Public Health at UBC. He's also a professor at the University of Washington. Professor, thanks for joining us. You had a recent study looking at whether processed foods are linked to colon cancer. What did you find?
Yeah, well, specifically, we were looking at three different types of processed foods, and one of them, processed meat, we found was associated with about a 30% increased risk of colon cancer for only as little as one serving a day. So that's sort of equivalent to something like a hot dog a day had that increased risk.
How does that compare with other studies you've done? That seems high.
Yeah, so what we did is really we gathered all the data from every study that we could find that had been done over the years and throughout the world, and really tried to sort of aggregate all of that information and put it together in a consistent way. So studies are really actually all over the place. And like many studies of dietary factors, there's a lot of noise in the data, and really that's what we're trying to do is kind of cut through the noise and coming up with kind of a consistent number.
Now, Statistics Canada shows colon cancer rates have been rising, particularly in younger adults. Could processed foods be the culprit, or is there something else you found that could point to a cause?
So it's probably one factor, but we know there's many other risk factors for colon cancer. So some other dietary factors, and we have to think not just what people are eating, but what they're not eating. So for example, if you have a diet high in processed meats, processed foods, red meat, you're unlikely to be having enough fiber or enough whole grains, enough leafy vegetables that have high in calcium. And actually, we find that diets low in those things are also cause for increased risk of prostate cancer. But then there's other things like physical activity and just the level of obesity that we have in our society today.
What would you like to see or recommend in terms of public policy about eating processed foods?
I think in general, we need to make it easier and less expensive for people to access the foods that we know are good and healthier for people. It's very clear that the cheapest foods are the least likely, the least healthy, easiest, the fast foods that people can get when they're short on time are generally highly processed. So we need to just sort of rethink how to make the healthier foods, and we know what they are, more accessible and easier for people to access, and actually people will do that if we make it easier for them.
University of Washington professor Michael Brauer, we appreciate your time and your expertise. Thanks for joining us.